Good morning, everyone. Welcome to the Health and Human Services meeting. I'd like to call the meeting to order on April 21st at 8:50 a.m. Will the clerk please call the roll?
Legislator Kelly? Here. Legislator Denton? Here. Legislator Block?
Here.
Legislator Burtis?
Here.
Chair Romeo?
Here. First order of business is to approve the minutes from the previous meeting. Are there any objections to the previous minutes? Seeing none, the minutes are approved. Our first order of business is our guest from Adult and Long-Term Care Services. So if you three could please introduce yourselves and your position, we would appreciate it.
Yes, good morning, everybody. I'm Joanne Spoto-Decker, Commissioner, Onondaga County Department of Adult and Long-Term Care Services. And thank you, Chairman, for having me here today. I'm also accompanied by our Deputy Commissioner, Maria Mahar, and our Public Information Specialist, Nate Overdyke, who's been here a whopping 2 weeks. What he's made for us today is pretty incredible. So thank you, Nate, for putting that in. So I can begin? All right. The Department of Adult and Long-Term Care Services is dedicated to improving the quality of life and overall well-being of adults aged 18 and older. We provide support through a coordinated network of direct services, programs, and local resources designed to meet the diversity of need in our community. Should I be?
Yeah, just a little bit closer.
Oh, a little bit closer. Okay. All right. How about this? Is that okay? Okay. Our mission reflects the evolving reality of aging. Today, older adults are living longer, healthier, and more independent lives. Our goal is to support this independence by ensuring individuals have access to the services and resources they need to thrive. The department is comprised of 4 key units: the Office for Aging, Adult Protective Services, New York Connects, and the Long-Term Care Resource Center. Together, these programs offer guidance, protection, and access to essential services. We are funded by the Onondaga County Legislature, the New York State Department of Health, the New York State Office for the Aging, the New York State Office of Children and Family Services, and any additional grants we can have. Through these partnerships, we remain committed to enhancing community well-being by promoting knowledge, access, equity, and advocacy, and by fostering a safe and healthy environment for all. Now, this is a pretty old slide, but it still reminds us of how many people live in Onondaga County. And 2022, we had 476,516 people, and an amazing 26% of them were over the age of 60. And I'm very proud to be part of that over the age of 60 crowd. So the first unit we want to talk about is the Office for Aging. We're going to start with ISEP, Expanded In-Home Services for the Elderly program. Everyone familiar with ISEP? All right. ISEP is an in-home, non-medical care program that supports frail individuals age 60 and older who are not enrolled in Medicaid. The program provides case management, personal care services, respite care, and more, helping clients remain safely in their homes and maintain their independence. ISEP offers assistance with daily living tasks such as housekeeping, cleaning, laundry, as well as personal care needs, including bathing, dressing, and other essential activities. Services are provided on a sliding scale fee, ensuring accessibility based on a client's financial situation. Care managers conduct in-home assessments to evaluate individual needs and develop appropriate service plans. In addition, ISEP supports family caregivers by offering short-term respite, allowing the time to rest and attend to personal matters. Aid services are delivered through licensed agencies or a consumer directed model, giving participants the flexibility to hire and train their own aides. With fall prevention being a key factor in healthy aging, we are especially proud of the increased distribution of the Personal Emergency Response System, known as PERS, the PERS device to our clients with mobility challenges. Currently, 165 clients are being served with PERS through the Office for Aging. We're also proud of the volume of care provided to frail seniors. An impressive 47,518 hours of service delivered in just 1 year. If you're a math person, that's the equivalent of 5.5 years of 24-hour care within the same time period. Our next one. This is long, so I have to make my water.
Can I
We have a lot to talk about. Yeah.
before we go? So is that each of these are different clients? Like would any of the clients overlap in these programs?
I'm sorry?
Would any of the clients overlap? Like
Yes.
if this is an individual or okay, so it wouldn't be like it wouldn't-
Someone could get ISIP and then they can get Meals on Wheels. And yes,
And then-
absolutely. It's
How many employees are kind of handling this program?
We have, in the Office for Aging, we have 11 staff right now. We also have multiple contracts with other agencies, which I'll get into. Okay, oh, sure. So the food, meals, and nutrition assistance. Senior nutrition services is a vital part of the Office for Aging, addressing the growing demand among today's seniors for nutritious food, meals, access, and supportive services. Our team provides nutrition screenings, individualized assessments, and diet counseling for those at risk of poor nutrition. Following NYSOFA, New York State Office for the Aging Guidelines, and delivered by a registered dietitian. We currently operate more than 30 dining sites throughout Onondaga County, serving individuals age 60 and older. These congregate meal sites do more than provide nutritious food. They help seniors save money, stay active, and build meaningful social connections. As a result, we've seen a 52% increase in the number of meals served. For seniors who are unable to attend these sites, Meals on Wheels delivers meals directly to their homes. This program has grown by 45% and provides not only nutrition, but also an important safety check for people living alone. Another key initiative is our Farmers Market Nutrition Program. This program supports both low-income seniors and our local farming community. This year, funding increased from $75,000 to $112,500, allowing us to distribute 4,500 coupon books. These vouchers can be used to purchase fresh, local grown fruits and vegetables. And finally, we offer monthly nutrition education programs to help seniors make informed, healthy choices and maintain their independence. Our nutrition program is one of the most stellar in New York State, and I have Maria to thank for that. Maria's been with she's a registered dietitian also, and a nutritionist for years, and she has really built our program. So I want to thank you for that.
Joanne.
Ask about the Meals on Wheels program. So we've had a couple winters now that are more like central New York winters after a few years where they were a little more temperate. I know one of the things that we've discussed in the past was the blizzard boxes for folks to make sure that if we're dealing with adverse, weather conditions, bad roads, as nutrition. So how did we do this year with Blizzard boxes, and what were the budgetary impacts to make sure that that need was met?
So you are right, it was a normal winter. So what we did, we start planning in August and September to start the meals, and of course, we provide information for them. So these blizzard bags went out in October because we don't want to wait the day of.
Sure.
And so that was for December, and then we realized it was starting to get worse again, so we sent another batch out to all the people. And we not only take care of the people that we fund, but we also take care of other home delivered meal agencies that aren't included in the funding.
Can I just quickly pause? Could everyone turn their mics on? I think that we forgot to usually already do it, but can you make sure you look at the top of your mic?
Would be pulled forward.
Okay, thank you.
You want me to say it again?
No, I think
You good?
to begin.
The-
Perfect.
I have a
Can-
loud voice.
For those who aren't familiar with the Blizzard box, can you explain it?
Pardon me?
For those that aren't familiar with the Blizzard box, can you explain what that is?
Sure, it's a box, and
Got
it
it.
has stable meals. So for example, it could have like a can of beef stew or goulash, raisins, juice boxes, boxes of milk, crackers, just enough for 3 days worth of meals. And then what happens also, in addition to, if I can expand, for the winter, during the summer, we also send out, when it gets really hot, they send out water bottles, things to remind them that it's going to be hot out. And I know we all know when it's going to be, but we just kind of remind the older adults that, and if they need any help, they can just call our office, and we'll assist them. But
Yeah, I think especially with the rise in energy prices that we've seen, it's important to have those reminders to people that poses risks to especially older adults that don't have the same level of thermoregulation. So that's great.
And also, when there is a storm, they already have their boxes, but all the caseworkers call the people who don't have anybody to help them. So, for example, if they don't have a neighbor, we have a list of people that are at risk, that they have no one. So we call them up to make sure they have everything they need. In addition to food, we make sure they have the medicines that they need, and that they're okay. And that's what we do, because especially like people that are diabetic, we make sure they have the medicines. Any
Great.
more questions?
Question? No, thank you. But I have a question actually about something else. The coupons for the farmers market. Can you explain how people get them, how they qualify, and what they get?
So the coupons are for low-income adults. So they have to tell me again.
That's okay. I'm trying to speak in the mic. How do they get them, and how do they work? Do you like mail them? Do you have to pick them up?
Want me to answer it, John? Okay. So in June, we received the coupons, okay? And what we do is, well, the regulations state that we target areas that do not have easily access to fruits and vegetables, low income, and people with health disparities. So we target those senior centers, and we email them and say, okay, how many do you need? They start telling us how much they need, and then we set that aside. And then also we go to the different markets. So we, of course, go to the regional market. We go to all the markets throughout the county, and we start scheduling people to go out there and distributing the coupons. So each person gets a packet with 5 coupons in it, and it's worth $25. And it's one per person in the household. So if there are, you have to be an older adult, so like a couple can get 2 coupons. And if they live with their sister or brother, they all get coupons. It used to be that only one per family, but now each person can get it.
Okay.
And our biggest distribution site is at the market. And
And people can just walk up.
you just
And then
walk
have
up
that
and they have to
discussion.
sign a piece of paper that says, declares that they meet the recommendations or the standards or criteria, and then that's it.
Great. Thank you.
Our next slide, caregiver support and education. We offer information and consultation for family caregivers. In our in-person and virtual caregiver discussion group meetings, caregivers share their experience and find peer support. The Institute for Caregivers, something we've had for more than 25 years, offers public education on various topics applicable to family caregivers. As you know, caregivers have many restrictions on flexibility and time, so these presentations are provided both in person or virtually through Zoom. We also, if you can look at our slide, we have a lady there holding an animatronic pet. So New York State Office for the Aging supplies us with animatronic pets at no cost, and they are distributed mainly to people that are suffering from dementia. And they're absolutely adorable. We were going to bring one today, but we weren't sure you wanted to see an animatronic cat sitting on the table. So, but they are a lifesaver for a lot of people, and they really provide a lot of support. Next, we have a collaboration with Department of Social Services Economic Security on a regular basis. We collaborate with DSSES as the secondary certifier for HEAP. In addition to helping hundreds of seniors with information and application assistance, we also make home visits to people who are not able to come down and apply for HEAP in person. We also have multiple outreach events concerning HEAP at various locations throughout the county. And during the HEAP season this year, we assisted 477 callers with related questions to HEAP, which was a lot of calls. Next is our community service programs. Transportation is one of the most requested services. Seniors who can no longer drive, have lost their primary driver in the family, or cannot use public transportation are reaching out to us for solutions. Our providers are seeing an increase in requests as people not only need transportation to doctor's appointments, congregate meals, and shopping, but also seek opportunities for socialization to support their mental and emotional health. Many of our providers are volunteer organizations, such as JET, Jordan Elbridge Transportation, where I'm from, Jordan Elbridge, and SAT, Senior Adult Transportation, which operates in Bridgeport, Manoa, and Kirkville. The diversity of agencies involved in our United ReRide program allows us to provide thousands of rides each year throughout Onondaga County, especially the much-needed door-through-door transportation for individuals with disabilities who cannot leave their home. In 2025, we provided over 30,000 rides to Onondaga County residents. Time Savers, another community service program, is a program established in 2009 that has operated successfully for many years. It is a minority and women-owned business enterprise organization that provides shopper services to frail seniors who are unable to shop for themselves and do not have anyone to assist them. Over more than a decade of service, Time Savers has provided thousands of trips to support our senior community. We are really proud to be aligned with such a dedicated and compassionate team. And as you can see from the slide, We provided 812 units of shopping. So that's one unit is one shopping service. So 812 units in 2025. Some of the other services the Office for Aging has is legal services for low-income seniors administered by Legal Aid Society of Mid-New York. My favorite program, the Neighborhood Advisor Program, through which we contract with multiple agencies to provide information and assistance for whatever their client needs. Project Fix, that's a partnership with Catholic Charities, which provides small in-home repairs. And the Relatives as Parents Program, in collaboration with Syracuse Housing Authority, offering activities and support for relatives caring for children. So that's the Office for Aging. Now I'm going to go on to New York Connects. New York Connects is one of the leading programs for information and assistance for long-term care needs across our state. New York Connects offers free, impartial information and assistance to Onondaga County residents and helps them navigate the often overwhelming range of long-term care services and providers. Serving individuals of all ages and all payer sources, New York Connects provides comprehensive, unbiased guidance and connects people to the programs and supports that best meets their need. Established statewide in 2006, it has become a trusted go-to resource for service assistance from birth and beyond. Recently, New York Connects has seen a notable increase in contacts from professionals, clients, and caregivers, with many seeking help related to low-income housing, Medicaid, and home-based services. This growing demand highlights the critical need for accessible, reliable information and support. The program in Onondaga County also received one of the highest levels of funding from New York State Office for the Aging outside of New York City. That really underscores our reach and impact. New York Connects, we provide services through home visits, and we accommodate many walk-ins, with most counseling conducted over the phone. In addition, we offer an online resource guide covering a wide range of services available through our county and printed copies for the mail. Each of you, we brought a little present. Each of you, we're giving it, this is what we have for people that are looking for services. And we also have all of our brochures. So if you want to pass that out. Thank you. Thank you. In 2025, we experienced significant growth in the number of people served through this program. Notably, there was a 547% increase in individuals seeking transportation programs and a 53% increase in families looking for facility-based services. As required by New York State Office for the Aging, New York Connects programs also distribute satisfaction surveys to a portion of our clients. And here we have a couple of surveys regarding New York Connects that I wanted to highlight, for I believe they encapsulate exactly why this department, this unit, is crucial as I am describing it. The first one reads about a daughter thanking New York Connects for bringing forth all the services available to them that they didn't know about. The second one reads about New York Connects being helpful to them because, as in the case with many people in our community, people don't know what they don't know. So they learned a lot about what's going on for services in Onondaga County when they call New York Connects. The office go next to the next unit I would like to discuss is Adult Protective Services. And Nate is going to be showing you some pictures that we have from Adult Protective Services that are thank you, that describe what our caseworkers go in and see on a regular basis and the need for helping people with in hoarding situations. Want to pass those around?
Oh, are they different?
Adult Protective Services unit provides services to at-risk individuals with physical or mental impairments to keep them safe from harm due to their inability to care for themselves or because of abuse or neglect by others. We conduct in-home investigations and offer case management and legal interventions when appropriate. Adult Protective Services acts as a guardian when a person has no one fit to make legal or financial decisions for them. We collaborate with and make referrals to internal and external agencies that can provide further assistance. Referrals continue to increase in Adult Protective Services. As you can see from our slide, we are up 8% from 2024, with 514 cases moved to assessment, meaning open. Our current goal is to align with the complexity of need for the most vulnerable adults in our county. From 2024 to 2025, there was an increase in the complexity of risk factors presented at intake, and they are untreated mental health, up 8%, financial exploitation, up 10%, and untreated medical conditions, up 15%. APS guardianship cases have arisen to unprecedented proportions. When I worked in APS in the mid-90s, we had 2 guardian cases, and they were my cases. Now, nursing homes are bringing residents to an Article 81 guardianship many times without our knowledge, and we receive the court documents after that. While many guardians are housed in nursing and adult homes, we still have multiple guardians living in the community that face challenges. Currently, we are up 11%, and the number is expected to grow as we finish out in 2024 or 2025. From mid-2024 to 2025, funds were used to provide emergency housing, visiting home aides, and other services, food, clothing, transportation, and furniture. 285 assisted hoarding cleanups. That's up 54% from the previous year. So the pictures you were looking at of the hoarding situations that people are living in our county are going up and up and up. Lastly, I want to talk about our wonderful nursing unit, the Long-Term Care Resource Center. The Long-Term Care Resource Center provides ongoing medically based care management for Medicaid-insured adults and individuals with disabilities of any age, from newborn to seniors. We offer 2 primary programs to deliver hands-on support. The Personal Care Program partners with licensed home agencies to provide trained home aide staff. The consumer-directed personal assistance model, an increasingly popular option, allows clients to hire, train, and manage their own personal assistants. And yes, this includes firing. Our highly qualified nursing team holds at least a Bachelor of Science in Nursing, with some possessing more advanced degrees. In addition, we provide free patient review instruments, PRI screenings, for community members seeking to assess a loved one's care needs and determine appropriate levels of support beyond independent living. PRI's patient review instruments can cost up to $200 when it's done by someone else. In our department, we do it free of charge. This essential service continues to be a growing and critical need in our community. And now, for some fun part of our conversation, we have favorite outreach events this year. In 2025, we held 122 events, reaching over 4,000 members of our community about what we can do for them. As is our yearly tradition, we have held our senior celebration luncheon to a great success. Many of you have already been to our senior celebration luncheon. And this year we are holding it again on May 14th. So everyone will be invited. Also, this year, 2025, we held the Elder Abuse Conference. It was a very informative time for everyone involved. We also had a special opportunity to get an early look at a film about Onondaga County Adult Protective Services being filmed right now from an organization in California. And the movie is called Hope, Heroes of Adult Protective. And Onondaga County Adult Protective was pretty the only one in the state that was selected to be in this film. So we're very happy and proud of them. Some of our initiatives that we've done in 2025, starting with a 2025 Senior Center Grant Award Initiative, over $205,000 was awarded to 19 centers sponsored by County Executive McMahon. We also opened 2 dining sites in 2025, one in Skaneateles and the other here in Syracuse at Syracuse Community Connections. They both were so exciting, and people were so thrilled to be able to have those centers open. In Skaneateles, there were over 100 people that came to celebrate with us. And a bonus statistic that I wanted to share as an accomplishment about New York Connects. Last year in 2025, they fielded 5,870 calls. 5,870. And those calls aren't just, I need a phone number. Those calls are counseling calls. So I wanted to put that as an accomplishment as well. So I think I'm going to be done speaking in just a second. So on behalf of Maria, Nate, and all of our team members, we are grateful for this opportunity to be here today, and we can take any other questions that you may have.
Do legislators have a question? Thank you very much. Yeah, Ellen.
I am curious, how are we doing with care managers in the community?
Can you speak up?
Sorry, how are we doing with care management in the community? How has the number increased in the last couple of years and availability of care managers, or where are we at with that?
For care managers?
Mm-hmm.
And no, so I'm going to ask you to repeat the first part of it.
Mm-hmm. Has the number of care managers available to seniors in the community increased in the last couple of years, or is it the same? Has it decreased? Where are we at with care management?
Thank you. It's been our experience that it's the same. There really isn't there hasn't been a decrease.
Okay.
So it's stable,
Okay.
which is good.
Yeah.
Thank you.
Anyone?
I like to echo a lot of the same points every time we're lucky enough to have you folks in to meet with us. But for people that don't know the economics of things like falls, for example, or nursing home care, it's really amazing what we do to keep people independent, to keep people healthy and mobile, living in the community. Not only does it really improve their quality of life, but it presents significant cost savings to the taxpayers to make sure that people are taken care of in a proactive way rather than after something goes wrong. So keep up the good work.
So, I don't know, we always use the statistics that 1 year's worth of meals always is equal to 1 day in a nursing home. So our goal is to keep people at home because, like Dorothy said, there's no place like home, right? So we provide all these services to keep people at home, and a lot of them, if they have an ADL of 3, ADLs, or more, they should be in a nursing home. But we have a lot of people that do have a score of 3, and we keep them in the community. And you're right, it does reduce the cost of Medicaid, right? And that's our whole point. And and it works. And we have a really great community because we have a lot of volunteers who, and it's very rare, not, like for example, in New York City, they don't have as many volunteers as we do. We have so many volunteers that deliver meals, provide telephone calls and things like that because, like for example, in North Syracuse, they actually have a waiting list to become a volunteer. Don't they? We have a really good community.
Great.
Yeah, I'd just like to take the opportunity to say thank you as a individual who's aging myself and I'm in the spot now where my kids are grown and my parents are getting older. As was said here, you don't know what you don't know until you get in this predicament. So as a man taking care of my aging parents one way or another, I appreciate it. And of course, can't say enough about your group, your staff, but also, all, as you said already, the volunteers and the outside agencies, folks doing just God's work, just giving so much of their time and their care to people that they do not know, and in most cases, and of course, which was touched on, the just checking up on people. So very important, as I've seen in my own life, just to make people feel seen, as they could go for days and days without seeing anybody potentially. And of course, mental health, of course, plays a large role and risk in this age group. And so all of these things together are very helpful, and I appreciate it so much. I really do.
And it's more than just a meal, right? So
Yes, oh, yes.
so if the delivering with each one gets a case manager, and that case manager will start to make referrals. So they walk in, they see maybe they need their house cleaned, they need someone to talk to, they need help with economic resources, and or the caregiver that, like for example, for you, it's very challenging to be a caregiver. Therefore, we have counseling services, we have classes, we connect with Oasis, and we have fall prevention. We have health promotion activities such as bingo size at the different senior centers where they play bingo and learn about nutrition. We have Tai Chi programs. We have Walk with Ease, which we partner with the zoo, and it's going to start up again in May, where we have people with arthritis, and they learn through this evidence-based program, which is based out in California. They do take very small steps, and eventually they're walking a mile, but they get to see all the animals too, and so that gives them incentives. And there's so many people that have said, I've not only lost weight, but I've improved my my arthritis, my mobility. So we have all these things going. We don't have a lot of people, but we just keep the passion going. And if you walk into our department, I guess you could say they really are really happy to be working with the people that we work with.
Great. One question for me is, what's our relationship with the nursing homes, and what kind of interactions do you have? You had mentioned how they bring cases without you knowing. Can you talk about your whole relationship with them?
With nursing homes?
Yes.
The Long-Term Care Resource Center does, yeah, and very much so. And particularly during COVID, we got to be real close with the nursing homes. So we do have that. Our nursing unit is very small. We have 4 nurses, but we are able to reach out to any of the nursing homes that need our assistance.
Okay.
And they also reach out to us. They have an outreach program, and they connect with us to come and do presentations. So it's a reciprocal relationship with the nursing homes.
Oh, absolutely.
Yeah, right. So Joanne can call any nursing home. She knows every single administrator. So if somebody, and they're all different levels of nursing homes. So if someone needs to go to nursing home, or we have somebody that needs services, because sometimes, for example, Loretto has the PACE program, right? So we work with them to provide Meals on Wheels, and then we also promote some of our health promotion programs. So our relationship with the nursing homes have always been great because they know that if they can't stay at home anymore with the services that we have, then the next step would be probably the nursing home.
The issue with nursing homes though is that they are full.
Yeah.
And that's also.
So there's a need for more capacity locally? Okay. Now, what about oversight or accountability for nursing homes or apartments that are dedicated for seniors? Do we have any role in that?
We don't have oversight. The Office for Aging does not have oversight, but we have good relations with them. Yeah.
Okay.
It's the state. The
Yeah.
state runs the nursing.
I didn't know if we played any role in what happens in some of the more senior housing in terms of being able to go in and just check on people. Are there restrictions associated because it's I'm thinking of a Valley Vista, right? Or an apartment it's just a bigger kind of space. But that's fine. I can understand that.
But so you're talking about senior housing, like for example.
Yeah. Yeah. So senior housing as well. I was trying to blend the two, but I know they're drastically different. But yeah.
We don't go and audit them or do any type of monitoring, but we do call them if a senior calls and they have an issue with a senior facility, like Brighton Towers. We're in there, and so we don't say you have to do this or you didn't do this, but we kindly remind them of the importance of being stewards of older adults and how can we help them do a better job. So we don't go and police them, but we do try to help them with resources and perhaps, what they need to do a little bit better.
Chairwoman Watts has a question.
Yes, hi. In preparation for this, I had the chance to tour a number of our affordable senior housing in my district and meet with the stakeholders that run the community centers and some of these houses. We have 8 affordable senior housing and soon to be 9 in our community. And a consistent message that I was hearing is that the push-in services that existed before COVID are not taking place anymore post-COVID, such as haircuts and yoga and things of that nature. And I know part of that falls on the Christopher communities and SHAs, but it also feels like it's something that we could work on from the Office of Aging in the county. I was wondering if you could speak to the potential of getting more into that to be able to provide those services again post-COVID, what that would look like, if there's budgetary needs associated with that.
Yeah. Well.
Mhm.
And I hear what you're saying.
Okay.
So we can come on.
Yeah.
Yes, absolutely. So
It's a very bad.
Try without the
It's-
try without the mic.
try with that.
Just to repeat it. Yeah.
So I met with a number of our affordable senior housing places in our community. And they said that the push-in services, like the haircuts and the yoga and some of the mental health checks and things like that, have been discontinued after COVID. And I know some of that is Christopher Communities, SHA, but I'm wondering what the Office of Aging has that maybe we could push some of those things back in, if there's some budgetary needs to make that happen. We're talking about hundreds of seniors that it could make a real quality of life difference to have that available in these buildings.
Well, thank you. We do have that. And we do have a lot of programs that we understand.
I'll go over here so you can speak in the microphone. Look at me. Sorry about that.
So, we do. We have, Maria, you want
We
to
talk
talk
about
about Walk with Ease and all the other great things.
So obviously we can't give haircuts, right? But we do partner with Christopher Community in a different services. So we do a lot of health promotion. So we do, we every month we provide services, monthly in services with them. We work with the, I think they have apartment building managers, right? So we connect with them in make sure they're part of the farmers market coupon distribution. We do connect them with SNAP Ed. We have somebody that does, if they're eligible for SNAP, we have education programs to teach them about healthy cooking and exercise programs. We partner with Oasis, which is a health promotion program, and we encourage them that they need to target people with low access. We do make sure that APS, New York Connects, ISEP, they go to Christopher Community and they do outreach for them. And then Nate, since he's only been here for 2 weeks, that's one of his directives, is to go out there and start promoting these programs. So it's starting, during COVID, people were hesitant to come out. People were scared, and then people got used to being alone or being in their apartment. So what we're trying to do now is go out and get people out of their apartments again and start socializing, because you are right, the mental health issue is starting to rise. And we also have a program called SHARP, right? So if, and we try to promote that, if there are people with mental health issues, we have caseworkers that go out and do assessment, and then we refer them to, I think, Helio Health. So we have all those programs. It's just getting, we're just getting the marketing out and getting people to do it, but we're working on it. And especially when we do have, like when we hand out the farmers market coupons, we have booklets that says, all right, here are all the programs that we have for you, so come out and join us.
Are any of those taking place in the buildings, or they are all things that require people to leave
No,
their building?
It's both. We go in the buildings or they come to a fair. So it's both ways, because there's some people just don't want to leave the apartments. But we do partner with all the Christopher community programs. Like I think we just finished a program in healthy eating, walk with ease, and the bingo size program.
Great. My last question has to do with transportation. I love what we have put together and what we're able to offer folks. One of the big things I kept hearing about was quality of life transportation. So they can get to doctors, they can get to food, these necessities, but they can't get to nature, to recreation that again kind of contributes to mental health. Are they not aware of a program that does exist, or is that in fact a gap?
So you were talking about transportation for nature, going out to other things other than
Someone wanting to go see the lake, go to a park. Yes.
Generally, our senior centers arrange for that. So we support senior centers with through funding, and if they're looking at an opportunity to go to nature center or whatever, they do that themselves. So we really don't. We provide the funding, and then the senior centers do whatever they need to do to help the people that go there.
Well, there aren't any restrictions on programs like Go-Go Grandparent, for example, right? I mean, if I ask Go-Go Grandparent to take me to Green Lakes, that would be an option?
Yes, we do have Go-Go Grandparent, and that's a very popular program, and it does. I think what we were talking about was a group of people going out, right? Not just somebody going out.
Yes, but I am curious if Go-Go Grandparent can do that and how that would work for someone.
So Go-Go Grandparent is one of our most popular programs, and as I was talking about, our transportation went up 500, calls to New York Connects for transportation went up to 547%. That's because of Go-Go Grandparent. So we are funded through New York State Office for the Aging for Go-Go, and the first year in 2024, I think we got a little over $100,000. In 2025, that went down to, I think, 64 or 65,000. So we had to cut the rides. And in 2026, we're at over a little over $100,000 again. That's because of also from a grant from the county executive to keep the program going.
And so when you say cut the program down, just to make sure I'm clear, because it sounds like this could be a niche fitter, and if there could be more funds put into it, it could help to serve some of these needs. When we're limiting rides, I was hearing things from the community like we get one ride a month. What is the actual parameters in terms of that limitation that the budget allows or doesn't allow for a senior to access GoGo Grandparent.
Are you talking about GoGo? Okay. So we had to, because of the funding decreasing in the second year, we did have to limit the rides.
So what does that mean
Yeah,
exactly?
yes, one would be one round trip,
One round trip per
month.
month. Okay, thank you.
So the different, like for example, Clover Corner or Huntington or let's say Northeast Community Center, they do go out to different parks when it's nice outside. So they do have, they go apple picking, they'll go all the different parks that we have here. So they do it as a group. With GoGo Grandparent, they can, when it first started, because of COVID, we had a lot of stimulus funds that went into funding GoGo. So we really marketed it and it took off, right? And sometimes the seniors would go to different parts, would go outside the county. So they would go to New York City using GoGo. They would go gambling and all this stuff. So it really used up a lot of funds. So we said, okay, you can't go to New York City. or they were really, seniors are very savvy. They would sign up GoGo here in Syracuse or Onondaga County. Then they would travel to New York City and they would just have a wonderful time in New York. So you know the cost in New York City is so much higher than it is in Onondaga County. So this is a partnership with Lyft and Uber. And as you all know, with Lyft and Uber, the rate does not stay at a certain rate. So they're pretty smart. So they know that when the need is high, they start raising the cost. And so that eats up our funding. And so we said, all right, no more New York City trips, no more going to New York City and traveling around. So we limited it to Onondaga County. And but we're watching it really well because I think we're doing pretty good now with the additional funds that the county executives has given us. We're keeping it stable, and it's been a really great program because a lot of the seniors have talked to us and they said things like, oh, now I can watch my grandson play baseball, or now I can listen to my son be a preacher at a church, or now I can go get my hair done, or just people are just so, or I can go to the airport and someone can pick me up. So it is a very a wonderful program, and we're just watching it because GoGo also increased their administrative rate because of Uber and Lyft. But I think right now we're pretty steady. I was looking at the numbers the other day, and it seemed to be. I think it's meeting the needs of the community. Of course, we're going to evaluate it, and if there's more need, then we'll of course have to readjust our criteria. But right now, we're doing well.
What's that? Do any other legislators have questions? Yeah. Go ahead, leader.
More of a statement. I want to say, first of all, thank you. It is a pleasure to sit on the Aging Committee for Onondaga County as a legislator and to watch the work that is done, to watch the diversity of the committee itself, right? And we now just also have partnered with an organization that helps our new Americans, and that is also a blessing because we often forget about the different diversities of the cultural seniors, right? And I want to say, I am going to continue to be on that committee. I just told our clerks, and I want to continue to do that work. And like you said, we do need to evaluate that Go-Go Puff just to see what areas also utilize it. I know a lot of my seniors in my district, as far as East Fayette Street, they don't really know about the program. So I'm looking and I'm eager to work with you for more outreach. And I just want to say thank you again. It has been a blessing. And I want to say to Chairwoman Watts, yes, we have been working greatly to make sure our seniors get to the parks, right? We just spoke with Commissioner Bryan to talk about adding a larger trolley because most of our senior organizations, they go there, then there's no room, right? Because the trolley is so small. So I can't wait for that initiative. But just thank you for coming in and giving us all of this information.
We're honored to do that, and we want to thank you for being on our Aging Services Advisory Board and being such a wonderful board member and a very caring board member.
Yes, and when we spoke, you know, even New Jersey, they had to figure that out real quick, right? They had to keep those rides just to the county that the rides specifically were to in New Jersey. So that is great. We do need to keep it to Onondaga County because we can't go to New York City. I want to go to New York City. Tim, can you take me?
Thank you.
Thank you all for coming. We appreciate your time and information. So thank you.
Thank you very much.
Thank you.
Nice to meet all of you. And nice to see you.
You as well.
That was a joke. We're the age that you take the ride. I need 8 more years to take the ride.
You need digital to submit it?
I'm from the city. I can survive.
Okay.
You doing New Jersey? Yeah. So they give them 30 when we spoke. Yeah, they give them 30 They would take the next one.
You could tell those notes in there were written by seniors because they still know how to write in cursive.
So we have more items. Excuse me, Leader Hernandez. We have more items on our agenda. If you can move your discussions. Spencer, you want to go?
I just need to drop.
Karen. A brief recess.
Yeah, 5-minute break, I guess. Availability because we were looking at the dates of May 13th at noon and May 14th at 6 p.m. We wanted to have flexibility for people that work during the day, but also people that work during the day and couldn't make it. So that's why we were trying to do the 2 different times, but it be one hearing that would be open for that amount of time. And I'm not sure who could or couldn't, but we did have a quorum for both of those dates. Wanted to have a discussion here to get any input. I don't know if, I guess it wasn't really described to you yet. So one of the things that I've been having discussions with the chairwoman about is hearing from the community about how Onondaga County can help address the needs that are out there. We know that given the range and complexity of all of the things that our children and families struggle with, this is an issue that needs every voice, every kind of opportunity that we can find to help people in the situations that they're in. This specifically is meant to hear what those suggestions are from the community, either what they think that we could do to help improve situations or needs that they see that aren't being addressed right now and that need to be addressed. So we would have these public hearings, hear what's going on, and then we as a legislature would work with the administration to find out how we can help those to be addressed, be it some of them with the administration just making tweaks to them, or we as a legislature providing funding to help them to take on any additional projects that they might see fit to address those needs. So that's what the intent of these public hearings is for, and I welcome any input, questions that committee members might have.
So you're going to have 2.
It is one that's going to stay open for that period of time. We're going to have 2 times in which we allow the public to present to us. So it'll be one public hearing that's open for all of that time. So we will welcome digital communication or any other form of communication in between that time, and we will just have those two physical locations, two physical moments in time.
Where's it going to be?
So the first one on May 13th at 12 p.m. is planned to be here, since we have this space available to us. I was actually meant to ask you all now for recommendations for the one on May 14th at 6 p.m. One of the places that we talked about was some sort of county facility like Central Library, but I didn't know how accessible that was to people in terms of parking. So I guess I have, that was one. Didn't know if we wanted to keep it at a county facility to decrease costs, if that was possible, or if other people had other ideas in terms of where we could have it. We can look into options. I have a couple of other options, but they're private options, and I think there would be a cost associated with that. We could do it at another library, but I don't know if there's capacity issues in some of our smaller libraries.
I know Central Library has a nice community room.
Yeah. Are you all, how do you all feel about Central Library and coordinating with trying to find if that's available with their community space that?
For the 14th, right, at 6?
Correct.
That would be the one? Yeah.
Yes.
Is it being accessible here, 6 p.m.?
Yeah, that's not,
Right.
we didn't think that was
Right.
a viable option.
Gotcha. Yeah, yeah. So, yeah, wherever you want to go.
People okay? Okay.
Yeah.
Because
Sounds good.
living in the city, like being downtown, is super easy for me, and parking is never an issue. So I wanted to make sure other people felt that way as well. I want to make it as accessible as possible with my blinders. Okay. So, well, I have to communicate with Central Library to make sure that that space is available for that time, but we will do that as soon as everybody's okay with that. Any other questions?
Are there legal reasons to present it as one public hearing rather than two separate ones? Is it something to do with the collection of minutes and how things get tabulated? What's the rationale there?
Because it's the same one, we would want to collect all of that information into one public hearing, like you said, with the minutes and such. But also, because we're limited to two public hearings as a committee for the year, we also want to leave the availability open for another one. I don't have any ideas right now, and I don't know if other people have ideas. But since it's the same topic, we felt like it was appropriate to keep it as one.
Just thinking out loud, I think there's potentially a trade-off here between quantity and quality. I think being able to really drill down on what it is that we're looking to address with some of these public hearings might be helpful, because there's all kinds of things that we could do for teens and kids and adults and seniors. Just thinking, how do we really target it as best as possible? And now maybe that's going to be a challenge if we're limited to two public hearings a year. Obviously, hopefully we always are soliciting feedback from our constituents on how we can do things better, what needs we can address in the community. But, I wonder if we could try to narrow it down to a department. So, this hearing is what can the health department do better to address these needs? What can DCFS do better? DSS. I'm just trying to think of how to make this as beneficial to all parties involved as possible. Just thinking out loud, if anybody has any thoughts.
So with that, I think that's a good point, but also I think if we do keep it more general, then we can tie those departments to the comments we hear, and so we can potentially see a gap of like, hey, we have these programs, but they're not out into the community, and we need to potentially do more outreach. And so I'm wondering if we do keep it more general, especially with the first one that we're doing, maybe that we try it and see where we are. Yeah. But I think based on this one, we'll definitely know a lot more for, if we do this again. Just some of my thoughts.
Yeah, so I agree. We were trying to find a way to make it as restricted as possible with also leaving it open. One of the concerns about bringing up a specific thing was people bringing personal feelings associated with either that department and it then becoming something that we didn't want it to be. That's why when we added the title here and we put how county services can address, because we were worried people would bring all kinds of needs associated with things that we don't have control over. It does say address the needs of children and teens. The recommendation, or there was a suggestion of making it children and families. We were really happy that we came up with the how county services can piece. So that was the part that we spent a lot of time on. So I'm okay with changing the children and teens or children and families. It is, obviously children. We would hope we're addressing the family's needs as well. So, I mean, I'm indifferent on how people feel about titling it that. So the restriction piece, we were concerned about that. And then again, keeping it broad, because this is so complex and we're trying to figure out just where something that we haven't thought about as a county before is out there. I think that leaving it that broad helps people to bring whatever kind of crazy idea about something that none of us have ever thought about before, makes it available for that.
Do we have any actionable steps that we plan to take based on the feedback that we received from the community? What's the process moving forward?
Yeah, so depending on what comes up in this, we will then decide if there's things that we can work on. So maybe we hear something and we say, hey, that's something that we want to find out more about, and we can continue to investigate. Maybe it's something where we talk to the administration and they say, yep, that's already happening, it's just a communication thing. Or it's a, we didn't think of that, we can do that right now. And so it's going to be a lot of communication between us and what we hear and the administration with what they're willing and able to do and what we can do on the legislative side. So it really depends on what comes out of what people say.
So what will be obviously a public hearing is for us to listen to what they have to say. What's going to be the mechanism that information gets transmitted back to the public? So if somebody says, I've got a pending application with this department on this program, I mean, what's the turnaround to say, oh yeah, let's talk to Commissioner Spododecker and she'll take care of you? How does that work?
Yeah, so I think that one of the things that we don't want is individual needs that need to be addressed. One of the things that I plan on saying at the opening is, like, we don't want any names named. This isn't personal feelings. It is how our services can better address needs. And when we talk about that, the individuals involved are semi-irrelevant in that, they're more a part of a system that we need to help more people with. So we're trying to stay away from that personal piece. And if somebody has an individual concern, we obviously will listen to that. But that is here's the number, here's the department, somebody that you can follow up with. So hopefully that can happen that night. We'll have people there. Hopefully they can just go up to them, give them that answer, and then they can help find whatever solution that they're looking for that.
So do we have those parameters in terms of, hey, member of the public, this is kind of what we're looking for in terms of a comment. This is kind of what we're not looking for.
Yeah.
But like in terms of time, in terms of, guardrails, if you want to call them that. I mean, is that something that's been formulated up to this point?
I think you're gonna have to take what you get.
Yeah,
right?
yeah.
Whatever's gonna happen, Dr. Kelly, is gonna happen.
Yeah. Yes.
And we can't tell anybody what to do, as was said, right? They won't listen, and so I think we just have to be flexible and see what we come up with and see what comes out, and hopefully there's enough needs of children and teens. I think that's the question. Is there enough there to motivate people to come out before you make it larger children and family? You could certainly do that too, but I think will be determined by who comes.
Yeah. And we don't have anything like formal rules of this, but it's in the messaging that I plan on putting that out. So if we move this forward, I plan on putting out a message that just says, like, this is meant to be constructive. It is meant to be, solving a problem that is extremely complex. And and how we message that, I think, will drive, who might come to this, and restricting some of that. And then, like I said, in the beginning of the public hearing, I do plan on just mentioning the no names thing. I just think that that's inappropriate anyways. And we'll do the best we can, and anything's going to come is going to come. And that's what we're here for, is to listen to whatever people have to say. Good. Chairwoman, do we have, because this just says informational, or discussion, excuse me. Yeah, this just says discussion. Are we voting on it now? Do we? Yeah. Yeah. Okay.
Oops, no, I wanted one.
Number 2. No.
Oh, that's
Yeah, I don't. That's why I asked.
Discussion. Big discussion.
But
Oh.
we need to make it happen. There needs to be a resolution.
I'm very confused.
something.
Okay.
I think we're still on number 2.
Yes, I think so.
Sorry.
Is there a resolution?
That's what we're discussing right now.
Okay.
Call. Oh, right. They don't have it. Right. They need to call.
Okay.
So, okay. We don't need a formal resolution, but is everybody in favor of it in an informal way? Yeah. All right. Then we will.
Informal resolutions?
Informal, like, hey, I want to make sure my committee is on board with the things that we're trying to do, and yeah.
Public input is good.
Yeah. Yeah.
The
All right.
resolution that we passed last session basically had built into it that we didn't have to pass a
Okay.
resolution for each of these.
Okay.
So you want me to dive in?
Yeah, yeah. Our next item is the discussion on corresponding outside boards and commissions.
So we're just gonna, the chairman is going to run through these different boards and commissions. It is our goal to fill all vacancies by this session. And so there's a number of these that are recommended to the CE, so that part, we can only do what he sends over. But we want to at least identify who we're recommending here, and then we will get all those over and hopefully all set for a couple weeks from now. I think that's
Okay.
all I have to say.
Great. So I have a list of them here. For Aging Services Advisory Board, I will be recommending Legislator Black. For Emergency Services Advisory Board, Legislator Kelly is currently serving, and I will be recommending continuing to serve. For the Health Advisory Board, I have been asked to be a part of that, so I will be on that, but that is open, and it was asked that Legislator Kelly continue to attend because of his knowledge. It would just be a formal appointment of me and then participation from Legislator Kelly, and realistically they're open, so others can join. For the Onondaga
Just
Tobacco.
real quick on that, I hope to continue. The only question I had, will that mean that I retain voting power? I just don't want to make motions or vote on anything if I'm not supposed to.
It's my
I'm there
understanding.
as a member of the community versus as a formal member of the board.
It's my understanding that it would be a non-voting position.
Okay.
Because there just isn't an additional slot.
And that is recommended by the CE though, so
Oh, okay. Got it. That's a recommendation, yeah, we'll be making to the C, so that'll be pending his approval. For the Onondaga Tobacco Asset Securities Corporation, Legislator Ryan has expressed interest in that, so I'll be recommending that. The second position on there is an open and available. I have not heard any interest. If anybody is interested, speak now. Forever hold your peace. And for the Youth Board, currently Legislator Meeker is on that. He has expressed interest in remaining on that, so I will be recommending that position. And then for the Veteran Services Advisory Board, that is an open position as well. Since most of us have positions, Legislator Burtis, are you interested in either the Tobacco Asset Security Corporation or the Veteran Services Advisory Board?
First would be Veteran Services, and then, yes, I've served on tobacco before.
Okay, so I'm happy to give you your first choice of Veteran Services Advisory Board. Not give it to you, I would recommend you for that position. And then with the open spot on the Onondaga Tobacco Asset Securities, I can fill that position if no one else is interested. Okay.
Highlight one thing, that part of the reason why we're connecting these to the committees, to the standing committees, is so that we can have a feedback loop. So just to highlight that if you sit on these different committees, if you can make sure that if there's anything of note that pertains to the Health and Human Services Committee, that we make sure we're having that kind of feedback loop in both directions. That would be helpful.
Tobacco, there's not much feedback.
I'll find out. Thank you. Thank you, Chairwoman. That should conclude our meeting of Health and Human Services, and the time is 10:05.
Are we not
Oh.
doing?
Make a motion. Is there another one?
Okay,
gotta go
that's
back.
just for health and human. Okay, I got you.
Good? Okay, can I get a motion to adjourn? So moved. Second. Thank you. All in favor?
Aye.
All right. Meeting's adjourned. Thank you.